You are welcome to my channel. Today I'll be addressing high troponins level, and specifically I'll be talking briefly about troponins and give us the list of possible differential diagnoses when we have high level. Okay, someone will ask me, why wasting your time on troponins? Well, someone is having chest pain. We want to rule out myocardial infarction. We've now run our EKG, maybe repeatedly. We've assayed the cardiac enzymes. Out of the cardiac enzymes, I want to pay more attention on troponins. Then why Troponin I attracting more attention than Troponin T when it comes to myocardial infarction? Then, what is high sensitivity cardiac Troponin T all about? If we are faced with high level of Troponin I, besides acute coronary syndrome, what other conditions could lead to high level of troponins? All these will be properly addressed. Cardiac troponins are cardiac troponin I, cardiac troponin T, and cardiac troponin C. The brief history is that troponin was introduced in 1965, but not universally accepted until 1990s. It starts rising from 2 to 3 hours after injury. It's going to form a plateau between 12 and 48 hours. It will, however, start falling from the 4th day until the 10th day. By that time, it will be back to normal level. There's a normal range for the standard serum cardiac troponin, and the normal range is 0 to 0.4 nanogram per ml. But some put the normal range to be anything below 0.04 nanogram per ml to anything that goes above 0.4 nanogram per ml. Once it's above 0.4 nanogram per ml, it is indicating a probable heart attack, otherwise known as myocardial infarction. But you might also need to know that there is high sensitivity cardiac troponin T. We use that in healthy people or individuals with stable coronary artery disease. For what? We use that to estimate the risks of secondary events that can be predicted using high sensitivity cardiac troponin T. So the higher the level, the greater the risk of secondary events. Though they are healthy or they have coronary artery disease, they are not under stress right now, or they don't have myocardial infarction, but that prediction could be made using that high sensitivity cardiac troponin T level. Troponin release. It is released as a result of decreased oxygen and decreased nutrients. The commonest injuries leading to the release of troponin is hypoxic state, which means there is decreased oxygen compared to the demand. Hence, there will be a mismatch of the available oxygen to its demand, and then we'll have troponin being released in the circulatory system. There will be rise and fall of troponin level. The rise and fall can only be found in cardiac muscle, particularly in ischemia or infarction majorly, but not in other places. For example, in chronic kidney disease or chronic renal insufficiency or chronic renal failure, troponin may rise, but you will not have a rise and fall phases like it will be found in cardiac muscle damage. Therefore, there will be a steady state in chronic kidney disease, unlike in myocardial infarction, and that could be the key to distinguish between myocardial infarction and chronic kidney disease when it comes to troponin level. Now, because there is rise and fall, we need to have serial measurement of troponin. The serial troponin assay is pretty necessary, but as a matter of a disclaimer, I will state categorically here that please follow the protocol in your center or institution, or better still, call your cardiologist. Don't call me anywhere because each institution, each country, each health authority will have the protocol they follow. But one thing is necessary generally, we have to take the value of troponin as presentation, and 3 hours later, we repeat the same. Or you can take it between 3 to 6 hours after the symptom onset. If the initial test is negative, then repeat the same in 3 hours and another one in the following 6 hours. But I have said here, it depends on what is happening in your center. Please call your cardiologist to guide you. There is a 0 to 3 hour rapid rule out strategy. And what is that all about? They will use high sensitivity cardiac troponin to make that determination. Well, depends on what is happening at your center. Contact your cardiologist to make that determination. Okay, in heart attack or myocardial infarction, well, it might be ST elevated myocardial infarction. You remember acute coronary syndrome, right? The ST will be elevated, and then there'll be a rise in troponin I. There will be a rise in troponin T as well. I'll go into that later. In non-ST elevated myocardial infarction, there'll be no ST elevation, but the rise in troponin I will be there. Troponin I has a high specificity for cardiac muscle and has 100% sensitivity. I'm not ruling out troponin T, or I'm not saying troponin T is unuseful. Okay, let's go. Now, the specificity. Troponin I is exclusively found in the heart. Troponin T is very high. The concentration is very high in cardiac muscles, more than anywhere else, but it is also found in skeletal muscle. I think you can answer the reason why many physicians will answer only troponin I. But don't discount troponin T. Is also good to determine cardiac ischemia or infarction. But because it is also found in skeletal muscle, you might want to find out what is happening to creatinine kinase and the rest, and other stuff you can do to rule out skeletal muscle. So in the face of emergency, you don't have the time, no luxury to do all those things. You just go straight for troponin I. Now, troponin complex. Troponins, that is troponin C, troponin I, troponin T, can be found in skeletal muscle, in cardiac muscle, but never in smooth muscle. Now, more on troponin complex. Troponin C binds to calcium ions to do what? To produce a conformational change in troponin I. Troponin C will also help in transporting troponin I for muscle contraction. Troponin T, on the other hand, binds to tropomyosin, interlocking them to form a troponin-tropomyosin complex. Also, the same troponin T can bind C and I to the muscle fibers. Troponin I can bind to actin in myofilaments to hold the actin-tropomyosin complex in place. Okay, now there are so many situations when we assay troponin mostly Troponin I, sometimes Troponin T, and the value will be up, very high. What's leading to that? Okay, could be ST elevated myocardial infarction, could be non-ST elevated myocardial infarction, could be Prinzmental angina, also known as vasospastic angina. You can check my channel for all these. I have lots of presentations on them. Could be as a result of severe hypertension or severe hypotension. Also, troponins could be elevated in peripartum cardiomyopathy, hypertrophic cardiomyopathy, Takotsubo, that is stress-related cardiomyopathy, pulmonary embolism, in stroke. The list includes aortic dissection, blunt trauma to the chest, tachycardia, hypovolemia, sepsis, chronic kidney disease or chronic renal insufficiency or chronic renal failure. It could also be elevated in heart failure, respiratory failure, renal failure, implantable cardioverter defibrillator, that is cardioversion, myocarditis, rhabdomyolysis when it is involving cardiac muscle. Also in malignancy, systemic lupus erythematosus, Kawasaki disease, indicating autoimmune condition. In medications like anthracyclines, in trastuzumab, or in carbon monoxide poison. Could also be high in burns, barachnoid hemorrhage, sepsis, after cardiopulmonary resuscitation, or even in mental health-induced ischemia. Now, with this, I come to the end of this short presentation on troponins. We've seen the three types of troponins, how they are interrelated. We've seen how Troponin I could be more specific, but Troponin T could not be ruled out, and high sensitivity cardiac Troponin T being used to determine the degree of secondary events in healthy people or people with stable coronary artery disease. And we've gone through the normal level and serial measurement of troponins. With that, I come to the end of this short presentation. Seeing high level of troponin doesn't mean heart attack all the time, but it is going to help when we are faced with heart attack. Thanks for listening. Remember to share this. Remember to subscribe to my channel. I appreciate it.